Thank you. I'm honored to be a part of your first conference here and be in your wonderful city. It's also nice to be in the east where it's green. I live in the desert and we don't have rain, or at least we haven't this year hardly at all, and to see the green. So I was wondering, before I started here, just out of curiosity, how many people in the audience here are people with scleroderma? Okay, and how many of you are family or support significant others? Okay, thank you. And do we have any health professionals? So a few. Okay. Well, I focused my talk mainly directed towards the person who has scleroderma and their family or support systems. But because I thought there might be some health professionals, I did in my talk here include some slides that have the evidence for occupational and physical therapy intervention for that. So that's really for the researchers. And then the other thing I just wanted to say is that my email is on the slides here, and I'm happy to have you email me with any questions that you have, or if you are being seen by an OT or PT and they have any questions, to please contact me. Just make sure that in the subject area you put scleroderma, and then I'll know that I shouldn't delete it or anything like that. Okay, let's see if I can figure this out. Okay, so occupational therapy, these are really simplistic definitions of OT and PT. So occupational therapy is concerned with promoting health and well-being through engagement in occupation. And for the occupational therapist, occupation is not just your work, but it's your self-care activities, your instrumental activities of daily living, like the home management things, child care, yard work, those types of things, leisure activities that people like to do, and then also the actual occupational activities that people do, whether it's a job or being a student. And physical therapy is concerned with identifying and maximizing quality of life and movement potential with the spheres of promotion, prevention, diagnosis, treatment, intervention, and rehabilitation. And in both, I know the US and Canada, sometimes the roles sort of interact. We work very closely together in different facilities. OT may do one thing, PT may do another, and then you go somewhere else, you may have the opposite occur with that. So just going to give sort of a brief summary. Whoops, I do the wrong thing here. There we go. When I was in South Carolina in January, I met these two women, Linda McNamara and Karen Kemper. And Linda has lupus and Karen has scleroderma. And I love their little title of their book, If You Have to Wear an Ugly Dress, Learn to Accessorize. And so the disease is the ugly dress. And the accessories, I had emailed Karen and I asked for her permission to use the slide, but also if it was okay if I thought of OT and PT as accessories. And they said yes, that they could consider us as accessorizing strategies. But the other accessories are your support systems and the coping that you do, and your health professionals. So in people that have scleroderma, and just also realize that a lot of occupational and physical therapists, if you've been seen by one, you may already know that a lot of people really aren't familiar with scleroderma. OTs and PTs are trained to be generalists, and they're focused on the diseases that are more common. So our goals are pretty much the same: to increase participation in daily tasks, to increase joint motion, hand function, strength, general conditioning, and of course all those are with the ultimate goal to help you be able to do all your daily tasks and occupation. And then we provide education regarding assistive devices, alternate techniques of ways of doing activities, energy conservation, and pain management. And so I'm going to start first by talking about the range of motion exercises. And the purpose of range of motion exercises is hopefully to prevent or delay the development of contractures, especially in your hands, but also in your mouth, your face, shoulders, elbows, hips, knees, and so forth. And this is where sometimes therapists aren't really familiar with scleroderma, because in scleroderma, you guys that have it really need to do stretching exercises. It's not good enough to just do mobility types of things. So the exercises need to be done frequently, but they need to be done to a position of stretch and then to hold the position, which is very different. Now, if you have active joint disease because you have rheumatoid arthritis, then you need to be a little more careful about that. But sometimes when you're doing a position of stretch, you may notice too that the skin starts to blanch if you have Raynaud's, but you still need to hold the position and then make sure you move in the opposite direction and let the blood flow go back to your hands. So I like my talks to be interactive, so I expect everybody to participate as we go through some of the exercises here. So the first one I'm going to do is going to focus on the big knuckles of the hand, which are technically called the metacarpophalangeal joints, or MCP joints. And often in scleroderma, they lose the ability to bend all the way when you try and make a fist. So what I want everybody to do, and even if you don't have scleroderma, you can still do this, make a fist. And then if you don't have kind of a 90-degree angle there, then take the heel or palm of your other hand and push down. And you just hold it, and I usually say count to 5, 3 if you can't stand it, but slowly count to 3. Like 1 1,000, 2 1,000, 3 1,000. And then straighten your fingers back up. So if you happen to notice that they have lost a little blood flow there, that you let the blood flow return, and then do it again, and then push down on the back of the hand. I usually recommend people do like 3 to 5 repetitions, and then make sure you do the other hand too. I'll let you do your other hand, and then we'll move on here. So then the other joint in the hand that really ends up being affected is we call it the proximal interphalangeal joint, or the PIP joint. It's actually the middle joint on your finger here. And those are the ones that if you have contractures, that you tend to bump all the time. So people end up with kind of a claw hand. And there's about 3 different exercises. The first one is to push the hand flat. So if you put your hand flat on the table, and if it's kind of contracted, that's okay. Then you put your other hand on top to try and push the fingers flat so that all the surface of the palm is in contact with the table. And I know that might be really, really hard. If there's no way on this planet that you're going to be able to do that, and for some of you that may be the case, if you have, luckily I have this nice little podium here, but if you have an armrest or the edge of a table, you can hook your fingers like that, pull towards you, and then push the palm of your hand down. And again, what you're trying to do is to prevent those fingers, the PIP joint, from losing any more motion or extension with that. And then I'm going to do the one on the right hand side, which is pressing your fingers together. So for that one, you put your hands together like you're going to do a prayer, and your goal is to push your hands against each other. So you're trying to again get your fingers flat. You try and push them, because your goal, and it may not happen, but your goal is to try and get the palms, sides of your fingers touching each other. And so those 2 exercises are pretty easy to do because you do all your fingers at once, where the bottom one uses 3 points of pressure, and this one's a little more complicated to explain. So take your index finger of one hand, and then we're going to use these 2 fingers of the other. So your index finger is going to go on the palm side. So remember, that's the joint you're working on. So you put your index finger on the palm side above the joint, your tall man finger below the joint, and then you take your thumb and put it on the back of the joint. So these 2 fingers will push that way, and then the one over the joint pushes to try and straighten the joint out. Does that make sense? No? So, okay. So find the PIP joint. One finger goes below it. One finger goes above it, and then the thumb goes on top of the joint. So the thumb pushes on the joint, and the other fingers give counter pressure. I can show you at lunch too if you have questions. But it is more difficult. And for that one, you have to do each finger at a time. So it takes a little bit longer if you have to go through all these fingers and all that finger. And for some people, if you have severe contractures in your hands, you may not be able to do those yourself, and you may have to have a partner or family member help you with them. But it is a really good exercise to try and get the individual joints to stretch out with that. So those are the big ones for the PIP joint. Whoops, I don't know what I'm doing. I'm hitting the wrong button here. Okay, so we'll move on to the thumb. And the thumb is, one of our most important joints because we hold a lot of things with it. So what happens sometimes with people with scleroderma is that your hand tends to get in that contracted position and your thumb does, and you can't really pick up like a really big size object like a can or something like that. And that's called your web space in there. So the first exercise, or abduction is the technical term. So for that one, you put the pads of your index finger together and the pads of your thumb, so you have kind of a little heart in there. And then what you try and do is push your thumb and index fingers away from each other, kind of like the arrows in the picture there, to stretch out this web space. That. So I don't know if you remember, if you were kids or you have grandkids, here is the church, here is the steeple. So that's your steeple and you're opening the door and there's all your people. Actually, if you did that, that would be good for your fingers too, but we won't go there. And then the next one is for, whoops, did not mean to do that, is the thumb flexion. So for that one is to trying to bend your thumb. So you try and bend your thumb to touch the tip of the thumb to the bottom of the little finger. And then straighten it back out. And you can see in the picture in the slide there that doing that is really hard for the person in the slide, that they actually are starting to have some color changes. So, again, hold the position and then straighten your thumb back out again. And then hold it again. But those are really kind of key movements for the thumb. Now, what happens a lot of times in scleroderma is that these contractures can kind of sneak up on you. And you think that your hands are doing pretty good, and then you suddenly notice maybe you're sticking something in your back pocket or you're trying to put on gloves that your fingers don't go as straight as they should. Or when I was in Pittsburgh, I went and followed people for research, but a lot of people would say to me, do you have any exercises? And I would say, yes, here they are. And a lot of people say, oh yeah, they told me to do that when I was first diagnosed, but I didn't do it because my hands didn't feel like they were stiff or losing motion. So what you can do is you can make an outline of your hand. And if you have paper in front of you, you can just put your hand down. In our country, in the US, we make Thanksgiving turkeys out of our fingers, out of our hands. So you just draw an outline, like shown in the picture there, of your fingers. And you get your fingers as flat as you can, and you may want to push down on your hands and have somebody else draw around your fingers for you. And that's your template. And so maybe once a week, every other week, depending on, how aggressive your disease is, you put your hand down on the picture and you make sure that your fingers still fit into that. So you hope that your tips of your fingers still fit to the tips of the picture. So it's just kind of a way to monitor, your ability to straighten your fingers out. And then the other joint that gets tight is the MCP joint, or your knuckle joint. And this one's a little harder. You actually may need somebody to help you do this. But I just took index cards and actually what you can do is you can take 2 rulers and stick them on, and then make a picture like Pac-Man. Those of you are a little older like me. And it fits over your joint, and you cut out what the angle is of your joint, and then make sure you label it so you know what hand and what finger it goes to. And you can put that over there, and that will help you know. So if your fingers bend pretty much, but they start to straighten more here, again, you have a way to monitor that. You can take 2 popsicle sticks or 2 rulers and just tape them together, draw the picture of the angle, cut it out, and make it for each finger with that. Because I think part of what you need to do as a manager of your own disease is to really monitor what's going on. And these are just some simple ideas. And then the last idea for kind of monitoring your hand range of motion is for the thumb abduction, which is picking up the big fat object. So what you need to find is like the largest object that will fit into your web space there. And you need to make sure that the contact of that object fits all the way around your skin. And that's the biggest object. And it could be, a can of soda, it could be a vegetable can, it could be maybe a spice jar or a can of tomato paste, because those are a little skinnier. Now I don't know if I can do this without dropping the glass, but if there's a space in there, I don't know if you can see that, if my hand was contracted and I couldn't fit that in there, that would not be the object. So you want to find something that fits securely, and then you use that again to monitor how wide you can get your thumb open with that. So the picture with the red top shows that it fits pretty darn good, the white bottle, but if you look at the can on the hand over on the right bottom there of the slide, that object is too big, so you'd need to find something else to sort of be your template. So for the researchers in the room, there is some evidence that doing range of motion exercises, along with various other things like paraffin bath that I'll talk about in a little bit, do increase joint motion in people with scleroderma. And there is one study out of Japan that did self-administered stretching, and it does show. And I put these in here too because sometimes it's good for you to know that there is some evidence that occupational and physical therapy works. We don't have really large studies because it's hard to get a lot of people with scleroderma. OT and PT are not like giving, and I don't mean this disrespectfully to the physicians or anybody else, but it's not like giving a pill and giving different doses. It's harder to make sure that everybody's doing the same treatment with that, and that you have enough people. And then a couple of studies out of Italy, actually a lot of the studies that support OT and PT lately have been out of Italy, have looked at tissue massage and joint manipulation. So some people have told me that they do go to see a massage therapist, and that really helps their hands. And there is some evidence to show that. And then the recent study at the bottom there, when people have the early edema in their hands from scleroderma, that doing edema control or lymphatic drainage that they do for people that have edema from other diseases like cancer, the technique that they use actually reduces edema and helps to improve hand function. Okay, now moving on here. This exercises here, Dr. Pope talked about it, how people can get a really tight chest wall, and a lot of what we do these days is we sit over computers, and then if you have scleroderma and the tightness, then you tend to become kind of concave here. So these are exercises. Yoga is really great, but stretching exercises, the one where the two with the lady in the striped shirt laying on her back, really helps stretch out this chest wall here and your pectoralis muscles to help with that. So those are just simple things you can do. Those are yoga blocks, but you don't have to use a yoga block. You can use foam, what are they called? We call them noodles that you put in swimming pools, or foam things. You can chop those up and put small ones. You can even roll up a really thick towel and put it under. That one will kind of smush down after a few minutes with your laying on it, but still it's a little better. You can go up to a door, like your bathroom door or door into the kitchen, whatever is wide enough, and just put your arms up like that and lean forward, and all that helps to stretch it out. Maybe you do that like once a day when you go through the kitchen. People may think you're nuts, but that's okay. Wait till you see the face exercises, then they'll really think there's but yoga is good stretching, and the Scleroderma Foundation in the U.S. has a videotape, a DVD, of yoga exercises for people with scleroderma. It has one that you can do yourself, and then one that's assistive yoga for people if you need to have a helper family member do it with that. Okay, face exercises. So face exercises, a lot of times too, you don't realize that you're losing the motion in your mouth. You can't open it as wide as you used to until you go to the dentist, if you haven't been in a while, and it can't get in there, or you go have like a really big hamburger and you can't get your mouth around it. So it can kind of sneak up on you too. So there's some exaggerated facial exercises that you can do, and one of them is exaggerated smiling. So I want everybody to give me a really cheesy smile. I mean a cheesy smile, like, hope that guy's not taking pictures. Where'd he go? A cheesy smile with that. And when I was going to somewhere this summer, I was looking at, this talk about non-evidence, but I thought it was interesting. In the Sky magazine for Delta Airlines, it said that a smile a day keeps the doctor away. So say cheese. And then the other interesting part in the same magazine was that somebody looked at pictures of baseball players in the 1950s, and they followed them, and people who had the smiles in the picture of the baseball team, the real smiles, lived 5 years longer than the guys in the picture who weren't smiling. So I don't know how good a evidence that really is, but but it was interesting. So smile, again, it gets all those muscles involved with that. Other exercises are pursing your lips, like you're really pissed off at somebody, or puckering up like you're going to smooch somebody, or blowing up your cheeks, so like and these are exercises that you might want to do in the shower. Just because, and also it's the warm water on your face helps to loosen up the skin, and then people don't wonder what the heck it is that you're doing with that. And then just open your mouth as wide as possible. And then you can have somebody, like in the picture, one of your family members who's supportive of you, or even a kid, they probably think it was pretty funny, to take a ruler and kind of measure how wide you can open. So you can do from the bottom, the top of the bottom of your top teeth to the top of your bottom teeth. And then you kind of have another template to keep an idea on how wide you can open your mouth. Okay, the next mouth exercises are even a little crazier. So the top one is manual stretching of the mouth with your fingers. And what you do is you put the thumb of one hand on one corner of your mouth and the thumb on the other and the other. And then you stretch it. So that helps with the lateral stretching of your mouth with that. And then the bottom one, although it looks pretty weird, what it is a bunch of tongue depressors in a rubber band. But what you have to do, unfortunately, if I'd taken a picture from the side, that's not what you really want. You want it to go back to from the front to the back, because you're trying to have these tongue depressors go back to the molars to open up the mouth, to stretch the mouth opening a little bit. So you start with a pile of tongue depressors, as many as you can fit in your mouth, and have somebody put a rubber band or gum, I don't know what you call them, gum bands around it. And then you put that in your mouth, and it helps stretch with the opening of the mouth with that. And there actually have been several studies that show that the mouth stretching exercises do increase mouth opening. And the dentist that speaks at the Scleroderma Foundation meeting says that he recommends using these exercises right when you're waiting for the dentist or hygienist to come in. So even doing a few of the mouth exercises, especially the stretching and the opening, can at least make it a little easier for the dentist or hygienist to get in on your teeth. So moving along here, down the body, we're going to move to the lower extremities or legs. And a lot of times, the hands are probably what's more, in the face are what's more obviously involved in people with scleroderma. But when you really start to try and you're putting on your clothes, getting especially shoes and socks, you may notice that your hips are a little bit tight too. So the first exercise on the upper left is just really crossing your legs. You guys can all do this too. Just scoot your chairs back. And cross your legs so that your ankle is on your top of your knee. Now what you try and do is you push down on the knee, not too hard. It's good exercise. It stretches. So it stretches out really your inner thighs, and you may feel it in your rump a little bit too with that. So then let's make you all even, so why don't you do the other side. So then push down on your knees. Hopefully it should feel kind of good. Kind of good. Not real good. And then the other one, in the middle there, stretches the muscles on your outer thigh. So that one, you cross your leg, and then you try and pull it like towards you, towards the opposite side. So very good of those of you that are doing it. And then switch and do the other leg. And so you should feel a pull in your butt a little bit when you do that, because that's what it's supposed to be stretching. Okay, now you can sit back normal. Now you get your exercise for the day. And then the one on the right is stretching the hamstring muscles, which are the muscles that run along the back of your leg and help to flex your knee, but they get tight if you are walking and you can't straighten your knees, or your knees are really stiff and don't go straight. That is a good exercise to do for that. You can tell how tight you are by sitting with your legs out in front of you, either on the bed or the floor if you can get up from the floor, and then using a towel under your feet. You pull the towel towards you, and that helps to stretch out the hamstring muscles with that. So that can be really helpful. And it also helps to stretch. Some of you too may notice that your ankles, if you all try and like tap your foot on the floor, that your foot may not come off the floor very much. That may be because your muscles in the back of your ankle there are really tight. So having a towel around them and pulling on your feet helps to stretch that too. So it gets both straightening your knee and then dorsiflexion of the ankle. And the dorsiflexion of the ankle is important when you're walking or going up and down stairs. And I didn't cover, there's lots more joints in the body that I didn't cover. I really didn't hit the shoulder, and I didn't really hit the elbow. But again, doing motions to reach with the arm way up high, walking your hand up the wall will help a lot with the shoulder if you have limitations with that, or you notice that it's hard to do your hair or wash your hair when you're in the shower. So just a lot of it is stretching, but a lot of it is stretching, and like I want to remind you, is to hold the position. Don't just do it and then just do it to do it. Do it and hold it, and if you can, push on it for a little bit more stretch. So positive effects of conditioning and resistive exercise, and Dr. Pope mentioned this too a little bit, that there are a lot of positive effects. Strength is a big one, maintaining muscle strength by doing different exercises. Cardiovascular fitness, joint range of motion, improvement in daily activities. You're exercising and your cardiovascular endurance is improving, your strength and joint motion, then it probably will be easier to do different tasks. And then your feeling of self-confidence and self-efficacy tends to increase. And one more Delta airline thing. It was a really good book. I don't even remember what one it was. It just had all these helpful hints. Actually, it had all this helpful stuff to kind of support what I was trying to say. So they had a list of 5 simple steps to happiness, and one of them was exercise. And it just said, do whatever you want, what you can, and it creates the optimism with that. So one of the things that people ask is, what is the best exercise? And it needs to be something that you want to do and that you like to do, because if you hate it, you're probably not going to do it. Sometimes the challenge is to find something that you like to do, but there are many different things out there. Walking is the kind of more universal thing that you can do. I know you guys have a lot more, I am at altitude in Albuquerque, so we do actually have snow, but you have a lot of snow, and I don't know if you have shopping malls open for people to do walking programs in the winter, but that is a good idea. And also, if it's cold out, or even in the summer, because it may be too hot outside to walk. The bicycles are good exercises. If you don't feel you can ride on a regular bike, you don't feel safe enough, there are recumbent bikes that you can use. The swimming is really a good exercise for people with different rheumatic diseases, and a lot of the pool programs have warmer temperatures in their pool to help with loosen up your joints, and then you won't be cold from the Raynaud's. One thing about swimming with people with scleroderma is it does cause drying of the skin with the chlorine, so trying to make sure that you do use lotion afterwards with that. And then all the different machines that they have, if you do go to a health club or a gym, trying to make sure that, a lot of the machines that you can use may be hard on your hands, but, trying to use either the palm of your hands to push the different machines may work a little bit too. But just, trying to find something that you like to do that you will continue to do. And of course, it's always, like with everybody, it's always, if you have an exercise buddy, then you'll be more sometimes motivated or to do that. One way to keep track of your exercise is to do an exercise log. Try and write, what is your goal, what are you going to do, and then kind of keep track of whether you do it. With walking now, you can get those little cheap pedometers in most stores, the sporting goods stores, that can help you keep track of your steps, and then you can use those and kind of monitor if you want to increase, or you can just think in terms of little distances. If you can't walk very far, now can you go down to the mailbox, can you go down to the end of the sidewalk, the end of the block, if you don't want to invest in one of those. And when you start, and one thing about setting goals for yourself, after you set your goal, you should ask yourself, how confident am I that I'm going to reach this goal? And if you think on a scale from 1 to 10, and you're 10 being I'm really confident, and 1 or 0 being I'm not at all, and if you're below 5, then maybe you need to rethink the goal, because if you're not that confident you're going to do it, you probably aren't going to do it. So maybe you either change your goal a little bit. Maybe I'm not going to walk down to the end of the block, but I'm going to walk down 2 houses or something like that. Because if you don't achieve your goal, then you're discouraged, and then you're less apt to try again. And there have been several, for the researchers, different programs and research studies that have looked at sort of rehabilitation programs that have a combination of a whole lot of OT and PT techniques that have been shown to be effective. I'll just put that up there. And then a few, these are I think both out of Brazil, where they have had aerobic exercise programs. So now I'm going to switch gears a little bit here. We talked about range of motion, we've talked about conditioning and strengthening, and now I'm going to move on to talk about some of the different devices that might be helpful in doing different activities of daily living. And the first ones I have up here are what things you can use for manipulation when it's difficult to hold an object because of the contractures that you have. The one on the left-hand side there shows a cup with a large handle that may be easier to grasp if you have hand contractures. The wine glasses, or the glasses like you have here, that have sort of that narrower place down there that you can hold on to, are probably easier than holding it on here. I mean, I've had other people, if it's your own glass and you don't mind touching it, is holding on to the top of the glass too. And using straws if you can't get it to your mouth or don't feel that holding it a different way will help. There are foam that you can buy to build up handles on silverware. The one over on the right-hand side there is a cuff. Some people that I've worked with that have had a lot of digital resorption of their fingers or maybe the auto amputations have not been able to hold on to stuff, so the cuff just slides on, and then there's a pocket, and people can put silverware, combs, toothbrushes, and different things like that to help with. One of the things about the internet now is you can go online and Google things like assistive devices or built-up handles, and you can get all sorts of information on where to get this type of equipment. For a long time when I started as an OT, most of the time you had to get it from an occupational or physical therapist, but now you can order a lot of that on your own. For oral hygiene, again, oral hygiene is really important because a lot of times you have the small mouth opening. A lot of people have the Sjogren's, so they have the dry mouth, and the caries can increase, and you really don't want, and none of us want to have dental problems at all, because everybody hates going to the dentist. I hope there's no dentists in the group here, but most people, it's not the most enjoyable experience that they have. So one of the things is to think about what are the different appliances you can use to brush your teeth. Now, a lot of people have the electric toothbrushes. and battery powered. And those are really great because the brush on them tends to be smaller than your regular size toothbrushes. And they do a really good job of getting all the parts, if you don't have a lot of wrist motion or hand motion, to be able to do that. Water jets, children toothbrushes can be helpful because they tend to have a smaller brush on them. So if it's difficult to get into your mouth, the flossers, the electric flosser, I didn't even know one existed, but there are electric flossers. Those little ones that look like toothpicks may work pretty well. The Reach ones, there is the one in the pink there, those are commercially available. But the nice thing about them is the piece that has the floss tends to be a little less wide, smaller, and so you can fit into your mouth if you have a hard time with that. The toothbrushes, building up the handle, if you are really somebody that likes a regular toothbrush, can help if you can't hold. The really strange looking toothbrush in the middle there is a DEXA toothbrush, but the dentist that I know that works with people with scleroderma thinks that one's great, but it's kind of strange looking. But you can hold on to it if you have contractures in your hands. And just in regard to dental, I mean, I'm not a dentist, I'm an OT, so my job is to help people brush their teeth from the perspective of being able to be independent with these tasks, where the dentist is concerned with your real oral care. But they suggest things like, making sure that you schedule dentist visits where they just do a little bit at a time. And also, if you are noticing that you're having changes in your mouth and it doesn't open as wide, if you need major dental work, to get it done now, because chances are that your mouth opening is going to get a little smaller, and then it's even harder for the dentist and hygienist to get in there. And also remind your dentist places are cold. And, to ask them for blankets, and bring gloves and all that, which you do anyway, but to actually, when you call and make an appointment, to ask that they have blankets to keep you warm. Because if you're not warm, you're not comfortable, you don't relax. And it's bad enough going to the dentist anyway. But dressing devices. Again, sometimes the manipulation with the hand is difficult to do buttons and zippers. And most of the time what you would say is, okay, well, I'm not going to wear a shirt with buttons and I'm not going to do zippers. And that is probably the best solution to do that. But every now and then, if you have to wear a shirt with buttons for some reason, or, your slacks aren't dressy enough if they're elastic, then there are a bunch of devices that help pull up zippers and help button buttons. So there's button hooks, or zipper pulls, all sorts of gadgets. And then sometimes too, people have a hard time reaching down to start their socks over their feet. And the picture of the purple gadget there is a sock aid, and it has these handles on it. And you fold the sock aid in half, put the sock on, use the ropes to throw it down to your feet, and then pull it on. It doesn't magically get the sock all the way on, but it gets it started enough that oftentimes you can reach enough to pull it on the rest of the way with that. Or if you can't bend over, if that's uncomfortable. And then there's reachers that can help you hold on to things. If you get reachers, you probably need to try those out before buying them, because some of them are too hard to grip. And that may be really hard, or too wide and you can't even get your hand around it, so you have to use both hands to do it. And then there's long shoe horns to help get your shoes on. So there's a whole bunch of gadgets out there. And actually, if you are interested in them, and I know you guys have a lot of support groups here, if people have different gadgets, maybe at a support group you can bring ones that work for you and then kind of do show and tell to let people try them before purchasing them. Because some of them are costly. Different devices for holding keys. The scissors are kind of spring action scissors, so you push down and it cuts instead of having to do that with your fingers. Oxo, is that how you say it? Oxo, I never can say that right. Has these really cool things you can get. They're good grips, but I love the little jar in the center. You pop it, push down on it, and it seals, and then you push it again and the handle pops up, and then you can just lift the lid off. I thought that was just about the coolest thing I'd ever seen. But they are they are heavy. But they make the tools like for the graters and peelers but they're a little bit, have wider handles and rubber handles that are easier. Now the gadget in the bottom right, I've never used that. I found it in a catalog that my mom had, and I thought it was really fascinating. But it supposedly opens up pill bottles and rips the little plastic, or the foil junk off the back of pills. So I need to get one of those I can justify it. I make my students learn to use it. But I thought it was really cool. I have no idea whether it works or not, but it is kind of cool. More jar and can openers, and I have a lot of jar and can openers because that's what people tend to say it's really, really hard for them to do. Not pushing any brands, but the Black & Decker one a lot of people have, and a lot of people have those anyway, so they work really well. The can opener, the manual one, is again an Osco. Jar pops and jar poppers are things that people that I work with Scleroderma have told me worked really well for them. I had one, actually the most interesting one I had was a lady who told me when she went to the grocery store and had the person bag her groceries, she would have them pop the seal from jars and then have them put it back on tightly, but then when she got home it had already been popped, so she could get into it a lot easier. Okay, moving on to pain management. OTs and PTs have little ideas up their sleeves. Some of you have probably tried a lot of these, but heat modality is really a good one that helps to relax the tissue, increase the blood flow. So paraffin wax, have any of you tried paraffin? Do you like it? Yeah, paraffin wax, I have a picture of that in a minute here. And then I'll go back to that other one, is you dip your hand, it's liquid paraffin, it has oil in it, so it's got moisturizing, and it's hot. It's usually about 100, I don't know what it is Celsius, 126 Fahrenheit. What do you do, subtract 32, or I don't know how you figure it out. Anyway, you guys, you'll know. But you dip your hand in, and it makes like a waxy kind of glove. It's kind of cool. Halloween is coming up in our country, and it's really cool, so it looks kind of gruesome, but it has this really nice warmth and wax on it, and then you put either some saran wrap or wax paper around it and then wrap it in a towel, and it keeps the heat for about 20 minutes. And then afterwards, the heat, it feels good on your hands, warms your hands, but a lot of times I recommend people use the paraffin and then do the hand exercises with that. And the units are, you can get them at the home, for the home at a lot of your department stores. Oops. So other heat modalities are moist heat, and that could just be hot water. Hot water from running your hands under hot water, or hot water from in the shower. There are microwave packs that you can get. Oh, and then those heat packs, that you buy and you just crunch them. You get at the sporting goods stores. Those, do you guys try those? The chemical heat packs, those are just wonderful. I didn't really realize, my son was in a soccer game at one of the coldest days in Albuquerque, and soccer you actually play with your feet, but they do actually have to throw in the ball. So they gave all the kids these chemical hot packs, and they put them in their warm-up jackets, and after a 90-minute game, and my son still, my hand, of course everybody that wasn't playing soccer was really cold, gave those to me, and I was amazed even 90 minutes later how much heat that they still had with that. I think those are just one of the greatest inventions. And then gloves, the warm pool programs that I talked about. Massage can really be helpful to pain. For some people though, massage is painful. So you really have to find a massage therapist who's willing to work with you and do it on your terms, not what they, and come to a happy medium with that. And then relaxation techniques, doing the deep breathing or breathing exercises that are associated with yoga can help with relaxation and decrease pain. Progressive muscle relaxation, which is where you think about, you're on your back in a relaxed position, and you tense the muscles in your toes, and then you relax them, and then in your ankles and your calves, and then relax them, and you just kind of move up the body, so you're hopefully, when you're at the top, that you're totally relaxed. And then imagery. Imagining a place that's really calming to you. They have tapes that you can listen to, walk on the beach or babbling brook, or you're walking through a forest and it's all very calm. And all those are different techniques that people use too. Those show the different hot packs that are available. The paraffin wax. Don't use the paraffin with open sores. I don't think I said that, but probably not a really good idea. And then the last thing I wanted to talk about was fatigue. And I don't know if you can see the fatigue, the words on it, but they're all the different things in the I don't know what color it is. They're kind of lighter one, right around the fatigue one, have emotions, physical inactivity, daily activities, the holidays coming up, flares. And then those are just kind of the causes of fatigue. And then the yellow wheel are things to do to deal with the fatigue. Exercise programs, positive self-talk, support groups, check the medications, see the doctor if you need to. What are some other ones here? Plan and prioritize your activities. So energy conservation, think about what are the activities that you really need to do, how can you plan them, and then alternate light and heavy tasks. And this kind of gives some examples of energy conservation. You know, think about what are your priorities, what do you have to do. Think about what other people can do. You know, if you have family members, or a lot of times people have support that they don't want to be a burden, they don't want to ask somebody, but a lot of times people are perfectly happy to do it. Plan ahead, pace yourself, avoid fatigue, slow down, balance rest and activities. I talked to one woman on the phone, and she had a teenage daughter that loved to go shopping. And that was an activity they joined, but it was just too fatiguing. So they sort of had the deal that, you know, they would go to so many stores and then mom would have to rest. And then they would go to another store and mom would rest. Or if when she was trying on clothes, mom would rest in the chair outside the dressing room. So they could still enjoy the activity. And then posture, you know, sit when possible, but alternate. So if you get tired sitting, stand up and move around. I'm using good posture. I talked about earlier, a lot of us are sitting at computers where we're kind of hunched over, you know, taking posture breaks, sitting up, doing stretches. All the things that you may read about that they tell people to do, take, you know, breaks, move your wrists around, stretch your arms out, and then use good body mechanics. So make sure that when you are sitting and doing something, that the surface that you're working at is not too high. You know, a lot of people do use the computer. Make sure that the table's not too high. So your arms are like this. Make sure that this monitor is not too high, so you're like that, or too low, so you're like that. So all those different types of things can help. And I think I have run out of time here, so I will thank you. Again, just remember that, you know, use your accessories well. I think there's a lot of them out there, not just OT and PT, but your coping, your medications, your health professionals. And then I did put on this slide just some of the references that I had written a book chapter and an article that sort of summarized some of the OT and PT interventions that were out there. So thank you very much, and then we can eat, right?